Thank you for joining us on this Monday. To start things off today, Mayor Demings will start with our goals for the week at this press event. He will go into a brief update on weather and, of course, share the latest information on COVID-19 testing numbers, CARES Act funding programs, strike teams information, a note on blood donations, and another on voting. The mayor has a lot to cover today. From the Florida Department of Health in Orange County, Dr. Pino is here with the latest insight and analysis as to where we stand as we continue to battle the virus here in Orange County. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson, and good afternoon to all of you. I don't have to tell you that we're definitely living in some unprecedented times as we endeavor to deal with one of the most active tropical storm seasons in many years. But it certainly has impacted Florida and Gulf Coast states in the last several weeks. We're fortunate our firefighters were able to return without any particular problems. I want our public to understand that we are monitoring the weather phenomena going forward, and there should be some confidence in knowing that we have a very talented team here within Orange County who are well prepared, who have various contingency plans that have been put in place to deal with the weather phenomena if any one of them impacts us at the same time that we have the pandemic. With that, I'm going to transition and talk a little bit about just where we are with the pandemic within our community. We certainly have our challenges and we have new numbers to report. Each week we start off, I try to tell you what our goals are for the week, and I'm going to do the same thing because this is something that allows us to remain laser focused on the challenges before us. My top goal for the week since March really has remained the same, and that is we continue to want to contain the virus within our community. And we do that by ensuring that we have accurate data. So we will continue to offer free testing and personal protective equipment within our community. We will continue to offer financial assistance to keep our residents from being evicted, as well as keep our residents in stead where they have all of the things that they need, food and other services, mental health counseling, et cetera, within our community. And the last thing is that we want to continue assisting our businesses here within the area by ensuring that they're able to keep their patrons safe. We will continue to do distributions of hand sanitizer, PPE, as well as hold our businesses accountable to the CDC guidelines and mandates that we have in place. And we will primarily do that through the compliance of the strike teams that we have put in place. I'll talk more about that as we move forward. Since the beginning of the pandemic, Orange County has had a total of some 39,000+ cases within our county. That's significant. We had an increase of 82 cases since yesterday, but since our last briefing this past Friday, we've seen an increase of 439 cases over the weekend. So while we are doing okay in combating the virus, I still don't like the fact that we had 439 new cases since Friday. Dr. Pino will cover more of the details about the numbers, but an alarming 54% of the new cases are between the ages of 15 to 24 and 25 to 34. So they're young adults within our community. 431 people have died in our county as a result of the coronavirus. That number has not changed since Friday, if there's any good news in that. We certainly still recognize all of those families who have lost loved ones. You know, I see every day some of our staff here within the county who have family members who are testing positive. In some cases, they're testing positive. Some of their relatives are critically ill. So I know that the virus is still real for many people. So far, even with the reopenings, our 2-week average has been holding steady at 4%. Remember that this is just for a 2-week period of time. Our rolling average, however, is 11.5%, which is still better than the average within the state of Florida. The statewide rolling average is 13.39%. We have tested some 339,000+ individuals within our county. Our testing sites provide free face masks and hand sanitizers to residents after they make an appointment. In fact, we have given out nearly 1 million masks at our testing sites alone. So we endeavor to continue to do that. This week, the health services team is gearing up to offer free COVID-19 testing at Barnett Park. That will be from Wednesday through Friday, actually Saturday, because we're going to be working with the Center for Multicultural Wellness and Prevention during the Caribbean Health Summit this coming Saturday, September the 26th at Barnett Park itself. So we'll actually be at Barnett from Wednesday through Saturday of this week. Orange County Health Services will offer free COVID testing for individuals who are 12 years of age and up. At Barnett Park. You can get information by going to our website at ocfl.net/Barnett Park. Or you can go to ocfl.net/testing and get information. I've been asked by our One Blood organization to make an appeal to the residents of Orange County that they are in need of blood donations. All blood types are needed. The pandemic has significantly disrupted One Blood's traditional model for collecting blood. Many of the places where you would normally see the big red bus for blood drives, like high schools and colleges and other large corporate headquarters or what have you, that they are not able to go to those locations now because many of them are operating at reduced occupancy levels. So we need you, the public, to consider making blood donations to the One Blood. In order to provide this treatment, One Blood needs to help eligible people to donate their plasma. For plasma donations, please go to oneblood.org/COVID-19. Again, oneblood.org/COVID-19 if you're interested in making plasma donations. These are individuals perhaps who have tested positive for COVID-19, and those antibodies can be used to help combat the virus itself. Our business compliance strike teams had a successful weekend. They were out. They were working diligently to make certain that we were holding all businesses accountable. The teams visited many breweries in Orlando and found all of the breweries they inspected were in compliance and took great pains with their safety protocols. So far, they have visited over 2,500 businesses, and again, the overall compliance rate is holding at 94% in our community. They have re-inspected 234 businesses with a compliance rate of 84%. This morning, the strike teams inspected Walt Disney World's Animal Kingdom and found the theme park in compliance. The teams have now finished re-inspecting all 3 major theme parks as well as the 11 smaller attractions within Orange County. Remember, all of these sites submitted their reopening plans back in June and were inspected back then, and so we are just, again, holding them accountable. Our COVID-19 eviction diversion program is still accepting applications from landlords and tenants to help with overdue rent. Hundreds of applications are being reviewed as we speak. So far, nearly $140,000 has been paid to landlords since the program started last month, and 45 families are able to stay in their homes avoiding eviction as a result of this program. In case you haven't noticed all of the political ads on television, I do want to remind you that this is election season. Tomorrow is National Voter Registration Day. Just blocks from where I'm standing, the Orlando Magic players and coaches have joined forces with the supervisor of elections here in Orange County, Mr. Bill Cowles, to turn the Amway Center into a voter registration site on Tuesday, tomorrow, from 10 a.m. until 2 p.m. I want to encourage everyone to register to vote. Early voting starts on October the 19th, so you're going to be running out of time to register to vote if you have not done so. You can learn more information at ocfelections.com, ocfelections.com. And with that, I'm going to turn it over to Dr. Pino.
Good afternoon. Thank you, Mayor. Good afternoon, everyone. The Mayor gave you large details on the data, so I'm going to skip the portions that he mentioned. But it's a testament also of how much data our mayor consumes, and that's a great thing for us as EPIs. So our positivity rate continued to be around 96%, so we are stable in that regard. The mayor did mention that we added 2 fatalities. Those were occurred before the last time that we spoke to you. One was a 75-year-old male, white, and with underlying conditions. And the other individual was 81 years old, male, white, Hispanic, with also underlying conditions. But also we have some concerns that the mayor mentioned the fact that 54% of all cases are between 15 to 34. And it's basically young adults and their parents. That's where the pandemic is right now. Our epics were describing that way, and I think it's correct. And another interesting fact is that our median age continued to decrease. It's 33.21. It is decreasing faster than the state, so we are going a lot younger, a lot faster. And another interesting day is that we reach a plateau for the first time. So this graph, if you can keep it for a second, well, this is the plateau. Okay, let's go to this one. As you can see that we're not changing between week 39 and week 38. And, I did talk about the possibility of this week going over the numbers of cases that we had the prior week, but that didn't happen. We actually have the absolute same number of cases. On week 37, we have 725, and on week 38, we have 725. And that's called an epi plateau. The longer that we stay at this level, the more stable the pandemic is in our community. Now, the other graph that you put before, can you put that one back? This one is the mortality rate per week in our residents. And as you can see, there are 2 different elevations of the curve, one that occurs earlier and the one that we just experienced. Now, it seems a little bit higher the time before than it was after, but remember, this is a division by the total number of cases. So the more number of cases, so it proportionally goes. But what is interesting is that we have continue to see a decline in the death rate. And I asked our EPIs to do this curve because as the case got reported out of order, with the labs being delayed for some of the fatalities that we have, it could have given the impression that because the numbers were reported late, that that was not the case. So we went to the data and see the data, analyze it, and it is the case that our fatality rate continued to decrease. Another interesting fact in the data is that we have seen a small increase in the number of people visiting ERs for influenza-like symptoms. So flu season is starting. It is time to get vaccinated. People are starting to experience the flu, and the season will get full-blown soon. And, the vaccine needs a few days to be able to develop immunity. So you have to take it well in advance of when the season goes in the high peak so that you are protected from that comes. So this is really the time from now on, as soon as possible, to get vaccinated. If you have the choice, get vaccinated with a vaccine that has 4 viruses, not 3, It's called quadrivalent, so you have more protection. So when you are getting vaccinated, ask which vaccine are you getting, and get the one that has 4 viruses if you have the ability to get that one. The other thing that is interesting is that we got recently awarded by the CDC through the state of Florida, over $800,000 that we are going to use this year to increase vaccination rates for flu in our county. So we are expecting to do several point dispensing drive-through around the county, and we are searching and scouting for locations in each of the districts that we have in our county to be able to do a flu vaccination event on each of them. So stay tuned for how those additional resources are going to be used. I also would like to mention to you the test that we got. So yesterday, we received 2,130 negative cases. We received 82 positive cases, and that gave us a positivity rate of 3.71. In the last 14 days, we have been below 6 every single day. Also, we are today conducting testing, COVID testing at West Orange High School. We will be there today from 2 to 7 and tomorrow from 2 to 7. As you know, the Board of Education did put a release out that the school was moved into distant learning. And so we would like to do the same that we did at Olympia, is to take this opportunity that the school is vacant and being cleaned and disinfected to also bring the possibility for those individuals that are teachers, schools, students, as well as their family members, if they need to, and they are symptomatic, to get tested. With that, I will open for any questions that you have, Mayor.
All right, we will open it up for questions at this time. Ms. Lauren Seabrook has a question for Dr. Pino.
I have one for you too. And Dr. Pino said I got 3 questions today, so. I do have 2, one for you, Mayor, one for Dr. Pino. Mayor, for you, if you could maybe just tell us if you had heard any reports of how the bars went throughout Orange County over the first weekend of them being open. And then I just wanted to find out from Dr. Pino, being 2 weeks out from the Labor Day possible celebrations, are we doing better than maybe you thought we would be?
Based on the observations of our strike teams, the breweries were found to be compliant. I think that the bar owners did a great job so far of ensuring that the patrons and their employees were following all of the various CDC guidelines. So we remain optimistic going forward. So say it was a good weekend. So we want to see them continue to hold steady on that.
Yes, I think that we have learned our lesson with regard to mask use, social distancing, and taking care of everyone together as a community. We have not seen an increase of the number of cases, but we are not surprised by Memorial Day. We are actually surprised that the schools are doing better than we were expecting. Although, people could argue that there is a high number of individuals in quarantine and some individuals in isolation. I would like to remember that we have a student population of 200,000, over 200,000. So that number in scales is quite small. And I also pleasantly surprised on the boards too, because we have talked to them about how easy it is to work with them. To communicate, to have case conferences at the drop of a dime. We get on the phone all together, discuss these cases, the situations, explain to the board, offer advice, and they make those decisions. And how fast we are able to make this decision and go through this data is also a way to prevent further spread of any disease. So for that, we are very pleased.
Steve Hudak from the Sentinel. This is for Dr. Pino. So you talked about a plateau. and now we have schools open, we have high school playing football, we had UCF playing football, we have, and they have UCF, I think, having a home game coming up, bars are open. How do you explain this?
So I think it goes to the same. So for the opening of the bar is too early to say they have not had an impact. So that one I will hold judgment for another 10 days. But with regard to the schools and other activities, you are absolutely right. We have increased social activity, and we have not seen an increase in the number of cases that somehow was kind of expected. But I think it have to do, in fact, with, so we have the strike teams out there enforcing all these measures that were put in place by the county. You have the health services from the county doing testing around the county. You have us trying to control outbreaks. So I think the coordination effort that is going on between the county and the state at this level here in Orange County, as well the ability to work with the school board, is what is, and the community observing this step. Because, you know, we can do all the work in the world. If the community is not using the mask, not washing their hands, not keeping social distancing, then the results will not be what we are seeing.
May I ask the mayor to respond to that, please?
I'm going to concur with what Dr. Pino has said here. It takes collaboration. I think if there are successes that we have, it's because we are working across jurisdictions. We're working within Central Florida itself. We have a weekly conference call with the surrounding counties, and then within Orange County, we have great collaboration between the county and the municipalities and the state at this point. By the way, I did want to also mention that Mr. Scott Howard is here from the Orange County Public Schools. If you have any questions specific to the school district itself.
Hi, this is Francis Middle from Radio Haiti Tropical. And Mr. Mayor, we know that Orlando is a tourist economic driven. So at what point will you be satisfied with the result of the control of the pandemic that you will start inviting people to come to Orlando? That's the first question. And the second question that I have is for the school. I know that the school is open, the sport is already on. So what about the advanced program, like IB, like dual enrollment and advanced placement? Are they already on? And if they are, how can we know what school is giving them?
So Scott Howard will be coming forward, and he can address the school issue. In terms of at what point are we going to invite people to come, we're doing that now. Believe it or not, the Metro Orlando area, Orange County, had been number one in terms of tourist visits for the last many years. The last whole year that we have numbers for was 2019, and we had 75 million people who came here. And so we still, I believe, relatively speaking, we probably still are the number one tourist destination, even though our numbers are relatively low. We are doing all the things that we need to do to make certain that even from the convention business, that our convention center is safe. We have instituted various sanitary protocols at the convention center. We have invested in some infrastructure and capital items at our convention center so that when the convention business returns, we want to assure people that they can do so safely. So we have hosted several events. The AAU National Volleyball Competition was here. We hosted it without any significant issues there at the convention center. So we are open for business, but with reduced capacity. Our theme parks are reopened. We supported our theme parks and their reopening plans. And we have people who are coming in to support those theme parks. To date, Dr. Pino and the state has said that there has not been any specific outbreak associated with that. Perhaps many reasons, but I think the main reason is that our theme parks got it right. They are doing what they can to make certain that those areas are as clean as they possibly could be, and they have ensured that people are wearing masks, they're monitoring the social distancing, you know, watching the space and washing your hands, as Dr. Pino talks about. All of that is, I think you can see within our community through every different sector, the public and private sector, different institutions. You can't go in a public building and not see social distancing and all of the other measures that have been put in place. So what I'm saying to you is that we have learned to live with the virus and keep the numbers, even though we have reopened. We have kept the numbers low. We see our professional sports teams have re-engaged in various ways. Some have spectators, such as the professional soccer. The NBA certainly have been playing within the bubble. So all of that is happening, and to that extent, we are saying that we're open for business here within our community. If that makes sense to you. Okay.
Another thing I was asking is, are you following the national guidelines to do so, or are you going to do it and you see that Orlando is laying down, I'm ready to do that, or are you going to follow the CDC rules like they remove the guideline that they have before concerning the airborne, how the virus is being transmitted? So is it going to be on you right here? We see that how we got lower case every day, we're going to open and asking people to come in.
We have followed federal guidelines. We have worked with the state. We have worked with the governor. And where we have local authority, I have tried to make certain that we were decisive in taking action in a timely manner. You know, we instituted things such as the mandatory face covering order here within Orange County, and we did a number of other things over time to try to make certain that we stop the spread of the virus in our community. But ultimately, I'm going to pay attention to the experts, the physicians and the healthcare workers, and the data that is being collected. And then intuitively, you know, we have our own experience. We observe what is going on here, and that's why we have been collecting our own data and holding individuals accountable through our compliance teams. We're going to continue to do that. So if at any point Dr. Pino tells me that when he's looking behind the curtain and he sees a problem with an increase, a spike in new cases in our community, we're going to look at that information and make appropriate decisions and make adjustments where necessary to protect life, health, and safety. Okay. Other questions? Oh, Scott, the second part, reference to schools.
Just real quickly to address the academic issue, our academic programs are continuing where our students, whether learning at home, remotely, online, with their teachers face-to-face, or those that are, with their teachers through Launchette at home, or whether they're learning face-to-face. Programs, academic programs like IB, dual enrollment, they are continuing for our students. So.
And I have two clarifications to make. One is that when I say 96%, that is 96 recovery rate. And the other one is that I said to Lauren that 3 questions if it was only Steve and her. She forgot the second part.
Lord.
Next question for Mayor Demings. You just mentioned a 94% satisfactory rate for business compliance staff. Can you tell us or the public when business compliance staff goes to a business, what mainly they are looking for?
When the compliance teams visit the various locations, they are looking to make certain that individuals are wearing masks when they should be, that there's appropriate distancing between the patrons that is consistent with the CDC guidelines. In other words, they're looking for social distancing. Then they're looking for all of those sanitary protocols in place, to make sure that there's adequate hand washing stations, hand sanitizing stations in place, that employees who are perhaps serving food, et cetera, that they're wearing their masks. They're looking for those types of things when they go into those locations. And from time to time, we do receive complaints from the public that may be about individuals who are violating some of that, where employees aren't wearing masks or employees aren't wearing gloves on their hands, the tables are too close, the lines, there's a crowd in place, they have exceeded their capacity, and all of those types of things are there. Even the communication, we want to see the posting of the various protocols in place. As you can look around in this room, you see various signage about the CDC guidelines. We want to see the same thing in businesses. And if they don't have it, we provide collateral materials to them, a way for them to be able to do that. If they have a challenge with not having adequate supplies of facial coverings or surgical masks or face masks, we provide that to them. And so we're trying to make certain that everyone is going to be successful. Okay.
Hello. Dr. Pino, can you weigh in on this back and forth with the CDC guidelines that we saw over the weekend about airborne transmission with COVID? The CDC updated it to say that it was airborne through aerosol particles, then removed. What should people go by and believe? And as a person who makes health policy, I mean, how does something like this happen, like a back and forth like that?
So I don't know what's going on there. So the changing of the CDC, and I explained this before, the CDC doesn't have the power legally or otherwise to impose and enforce anything. That's why they call everything advice, suggestions, and so on. So we have developed protocols here that are in accordance with what we learned from the CDC prior to the pandemic and prior to the politicization of the pandemic. So we will continue to exercise the guidance that we received from the state of Florida Department of Health and the guidance that we receive from the CDC, and especially the ones from the CDC, we will adjust it to what the needs of the county are, which can be a little bit different than other areas in Florida. As you know, we're more urban center with a younger population, a lot of mobility, and a lot of business and activities that have to do with a lot of events and congregating people. So for that, we are a little bit different, even probably for the entire nation, as we face this public health crisis. The changing of the guidance, the fact that the guidance is on and off on the CDC website, it doesn't change the truth of the matter that the disease is transmitted. How much suspended, how long gets suspended, all those have to be studied. But that's why we wear masks. It's nothing new that it gets transmitted by air if you are too close to an individual.
This next question was texted in for you, Dr. Pino, or Scott Howitt with OCPS from Sierra Putnam. The first question is, Olympia High School closed in part after students tested positive after attending a party. Were some of the 10 positive cases at West Orange High School linked to that party? If so, how?
No that we know.
And then second, will the West Orange High School football team get to play this upcoming Friday? If yes, does this mean future teams at closed schools can continue to play if players test negative for COVID?
No determination's been made on the, as of now. The announcement was that West Orange was pivoting to launch ed for 2 weeks, and there's been no movement on extracurricular activities, including football at this time. I know there was some discussions with the Department of Health, but I don't think there's been any additional decisions at this point.
All right, this next question was texted in for Mayor Demings from Shannon Butler with WFTV. She wanted to get your reaction to the proposal by the governor today to crack down on protesters who have been violent.
I assume she's talking about the announcement that Governor DeSantis made about a new act called the Combating Violence, Disorder, and Looting and Law Enforcement Protection Act. Literally 5 minutes before I came down to the press conference, I was handed this information. So I have not been able to review it and formulate an opinion about it. What I will tell you is that we certainly are going to support the men and women who are in law enforcement as they have to go out and do their job to ensure the constitutional rights of everyone else. And so we'll just have to look at this. You know, what I would not want to see is any type of infringement on the authority of those of us who have to serve at the local level and deal with the issues that are unfolding as they're unfolding. We have to have the ability to make decisions in the best interest of our citizens real time as we are viewing that. So without looking at all of the different nuances of the act itself, I will reserve any formal comment about it because it's brand new to me and I have not read it. Okay.
And lastly, Ryan Lynch with the Orlando Business Journal for you, Mayor Demings. On the business assistance front, is the county seeing a need for additional funding or any new programs going to be offered?
What we are going to do is do an assessment of the expenditures associated with the various programs that we have put in place, the various assistance programs, and we'll make a determination from that about reallocation of any unexpended funds. We were given until December the 30th to expend the CARES Act funds that we received. And if there is no extension of the expenditure period of time, we will do an assessment here within the next few days of where we are today and make a determination of how we will reallocate any dollars to the various needs of our community. Okay. If there are no further questions, I would be remiss today if I didn't also acknowledge the passing of Supreme Court Justice Bader Ginsburg and what she really meant to all of America as she fought for equality for all people. And I certainly understand it, having spent nearly 4 decades in law enforcement. We know that we will celebrate her life and legacy. And over the weekend, I released a statement about her death. And what I said in that statement was that if you're like me, you know, while we celebrate her life and legacy, we're also pondering who will replace her. That discussion will continue, but we do appreciate the work that she did for the many years on behalf of all Americans. So from Orange County's perspective, I know that she had an impact on the people who live here as well. So thank you all for attending the press conference today, and we will see you soon.